Hi, my name is Angela Granger, and I have selected to present the disorder schizophrenia. This is for Dr. Jamie Arnold's abnormal psychology class. The history of schizophrenia. The word schizophrenia has only been used since 1911. However, the disease was first identified as a discrete mental illness by a Dr. Emily Kraepelin in 1887. Written documents that identify schizophrenia can be traced to the Old Egypt as far back as the second millennium before Christ. Depression, dementia, as well as thought disturbances are typical in schizophrenia. The heart and the mind seem to have been synonymous in ancient Egypt. The physical illnesses were regarded as symptoms of the heart and the uterus and originating from the blood vessels or from pus, fecal matter, a poison, or demons. A recent study into the ancient Greek and Roman literature showed that although the general population probably had an awareness of psychotic disorders, there was no condition that would meet the modern diagnostic criteria for schizophrenia in these societies. At one point, all people who were considered abnormal, whether due to mental illness, mental retardation, or physical deformities, were largely treated the same. Early theories supposed that mental disorders were caused by evil possession of the body, and the appropriate treatment was the exorcism of the demons through various means ranging from exposing the patient to certain types of music to dangerous and sometimes deadly means such as releasing the evil spirits by drilling holes in the patient's skull. One of the first to classify the mental disorders into different categories was the German physician Emily Kraepelin. Dr. Kraepelin used the term dementia praecox for individuals who had symptoms that we now associate with schizophrenia. The nonspecific concept of madness has been around for many thousands of years, and schizophrenia was only classified as a distinct mental disorder by Kraepelin in 1887. He was the first to make a distinction in the psychotic disorders between what he called dementia praecox and manic depression. Kraepelin believed that dementia praecox was primarily a disease of the brain, and particularly a form of dementia. Kraepelin named the disorder dementia praecox, which is early dementia, to distinguish it from other forms of dementia, such as Alzheimer's. He used this term because his studies focused on young adults with dementia. The Swiss psychiatrist Eugene Bleuler coined the term schizophrenia in 1911. He was also the first to describe the symptoms as positive or negative. Bleuler changed the name to schizophrenia as it was obvious that Kraepelin's name was misleading, as the illness was not a dementia. It did not always lead to mental deterioration and could sometimes occur late as well as early in life. The word schizophrenia comes from the Greek roots schizo, meaning split, and phren, meaning mind, to describe the fragmented thinking of people with the disorder. His term was not meant to convey the idea of split or multiple personality, which is a common misunderstanding by the public. Since Bleuler's time, the definition of schizophrenia has continued to change as scientists attempt to more accurately depict the different types of mental diseases. Without knowing the exact causes of these diseases, scientists can only base their classifications on the observation that some symptoms tend to occur together. Both Bleuler and Kraepelin subdivided schizophrenia into categories based on prominent symptoms and prognosis. Over the years, those working in this field have continued to attempt to classify types of schizophrenia. According to the DSM, there are 5 types of schizophrenia: disorganized, catatonic, paranoid, residual, and undifferentiated. The first 3 categories were originally proposed by Kraepelin. These classifications, while still employed in DSM, have not shown to be helpful in predicting outcome of the disorder, and the types are not reliably diagnosed. Many researchers are using other systems to classify types of the disorder based on positive versus negative symptoms. The evidence that schizophrenia is a biologically based disease of the brain has accumulated rapidly during the past 2 decades. Recently, this evidence has been also supported with dynamic brain imaging systems that show very precisely the wave of tissue destruction that takes place in the brain that is suffering from schizophrenia. To give you some examples of this disorder, a number of accomplished individuals suffer from this disorder. The film A Beautiful Mind, if you've seen that, depicts the life of John Nash, a noted scientist, and his struggles with paranoid schizophrenia. The film The Soloist explores the challenges faced by a Juilliard-trained musician, Nathaniel Ayers, as a result of schizophrenia. What is schizophrenia? Schizophrenia is a chronic, severe, and disabling brain disorder that has affected people throughout history. About 1% of Americans have this illness. People with the disorder may hear voices other people don't hear. They may believe other people are reading their minds, controlling their thoughts, or plotting to harm them. This can terrify people with the illness and make them withdrawn or extremely agitated. People with schizophrenia may not make sense when they talk. They may sit for hours without moving or talking. Sometimes people with schizophrenia seem perfectly fine until they talk about what they're really thinking. Families and society are affected by schizophrenia too. Many people with schizophrenia have difficulty holding a job or caring for themselves, so they rely on others for help. Treatment helps relieve many symptoms of schizophrenia, but most people who have the disorder cope with symptoms throughout their lives. However, many people with schizophrenia can lead rewarding and meaningful lives in their communities. Researchers are developing more effective medications and using new research tools to understand the causes of schizophrenia. In the years to come, this work may help prevent and better treat the illness. What are the diagnostic criteria? The diagnostic criteria includes delusions, ranging from paranoid delusions, delusions of reference, somatic delusions, delusions of grandeur, hallucinations. They can be visual, they can be auditory, tactile, olfactory, gustatory, and then there's disorganized speech. There's grossly disorganized or catatonic behavior. Negative symptoms, these are the lack of important abilities, and they include lack of emotion, low energy, lack of interest in life, low motivation. Affective flattening is a blank, blunted facial expression or less lively facial movements or physical movements. Then there's the difficulty or inability to speak. There's inappropriate social skills or lack of interest or ability to socialize with other people. There's the inability to make friends or keep friends, social isolation. And there's a special note that says that only one criteria A symptom is in criteria A is required if delusions are bizarre or hallucinations consist of a voice keeping up a running commentary on a person's behavior or thoughts, or two or more voices conversing with each other. The cognitive symptoms of schizophrenia refer to the difficulties with concentration and memory, and these can include disorganized thinking, slow thinking, difficulty understanding, poor concentration, poor memory, difficulty expressing thoughts, difficulty integrating thoughts, feelings, and behavior. There's another category of social/occupational dysfunction. There is duration, which states that continuous signs of disturbance persist for at least 6 months, and this 6-month period must include at least 1 month of symptoms that meet criteria A. There's the schizoaffective and mood disorder exclusion. There is substance/general medical condition exclusion. There is relationship to a pervasive developmental disorder, and this states that if there is a history of autistic disorder or another pervasive developmental disorder, the additional diagnosis of schizophrenia is made only if prominent delusions or hallucinations are also present for at least a month. There are positive symptoms of schizophrenia, and once again they go back to the delusions and the hallucinations and the disorganized speech and thinking. Grossly disorganized behavior as well, catatonic behaviors. Other symptoms sometimes present in schizophrenia, but not often enough to be definitional alone, include affect inappropriate to the situation or the stimuli. There's unusual motor behavior such as pacing and rocking. There's depersonalization, derealization, and somatic preoccupations. There's negative symptoms of schizophrenia, which is one of them includes the reduction in the range and intensity of emotional expression, including facial expressions, your voice tone, eye contact, body language. Then there's the poverty of speech. There is the reduction in difficulty or inability to initiate and persist in goal-directed behavior, and that is called avolition. And that concludes my introduction to the study of schizophrenia. I thank you so much for watching this, and be blessed.